Hi, everyone. Welcome back to the Laurel and Fig Podcast. This is episode 2. We are so excited. We are going to be diving into our birth stories with our first two, our first oldest.
Our oldest children,
yes. And we do just want to place a trigger warning here because we are going to touch on miscarriage and what it was like to go on to have a pregnancy after a miscarriage. So please, if this is something that is going to trigger you, please just skip ahead because it is only going to be in the beginning, or you can just look for our next podcast too.
Yep. Yeah, we totally understand needing to take space for that, and sometimes it's not always the best time for that, so we completely respect that.
Yes. We do have a sponsor for this episode. It is going to be Heart and Soul. They make wonderful watercolor affirmations, and there are a ton of different options there.
Yeah, they have a healthy living one. They have a Latina-inspired one. They have 2 different birth collections up there.
Yes.
So there's a wide variety up there.
Yes, and we personally love their birth collection. We have them in our pregnancy bundle, and they're just a great thing to be able to hang up in your birth space. Being a birth worker, I kind of know that a lot of times moms aren't always looking at them, but the partners are.
Yeah.
And they're reading them to the moms because they might not know what to say. And so these just have nice, simple phrases on them. There's something nice to look at and distract yourself in the early labor. And they're just really wonderful.
And I think, like, seeing them ahead of time, like, those things that you can, like, think to yourself, those little mantras you can, like, repeat over and over, can be really helpful, too.
I can do hard things. That's always a good thing
like my favorite one.
during labor because labor is the hardest thing ever. And so that is our sponsor today, and we're really excited to showcase them. We are going to have their Facebook, their Instagram, and their Etsy shop in our notes on the episode, so you can just go ahead and check them out. Yeah. Give them a like and maybe order some stuff that you like. So
Nicole and I actually both had miscarriages before our first, before our oldest children's births. And so our oldest children are our rainbow babies. And so if you don't know what a rainbow baby is, that is the baby that comes after your miscarriage or multiple miscarriages or losses, whatever that looks like for you. That is kind of the baby afterwards.
We did make a shirt for it. I mean, I'm not trying to showcase that.
But this is kind of a near and dear phrase for me.
It's a very personal.
So I have a picture of our our very first ultrasound for my miscarriage and this quote under it because that baby is still very much a part of our family and our kids know kind of her story and we didn't know if it was a boy or a girl, but we assigned gender of what felt right because it felt weird to say it. So we assigned a gender and a name because that felt good for us. That was something we went through. Yeah, that was our grieving process. And, we still celebrate her birthday. And when school comes back, I'm like, man, we would have had a second grader this year. And I mean, it was just that part of it for us. I know other people, don't want to acknowledge it at all. And that's totally acceptable too. I mean, everybody grieves in their own way and handles it.
There are so many ways to grieve the loss of a baby. And I mean, I always had a hard time being able to grieve because I lost my baby so early. But, I mean, that baby was loved and wanted so badly that it doesn't matter if you lose baby right after finding out you were pregnant or if it was, second trimester. It all is hard, to be honest. And one thing that really helped me, I'm a talker, obviously. And so I wanted to talk about it. Yeah. And I think the first reaction to a lot of people is, don't talk about it.
Yeah, we don't talk about miscarriages.
Yeah, I mean, we just don't want to know about it. And it makes us feel uncomfortable, so don't talk about it. But that was how I healed. I actually had my miscarriage the week before Christmas, which was really horrible.
Mine was 3 days after Thanksgiving.
Yes, so and you remember it, because we had actually bought all of our Christmas presents that year to be themed for telling our family we were pregnant. And so I cried while we opened gifts that year at Christmas because that was supposed to be so special. And it was so hard for me. And I started talking about it to my family. And it was amazing how many women came out of the woodwork telling me that they've had a loss that I had no idea about.
Well, I think so many people don't realize that it how often it does happen. I mean, that's 1 in 4, I think, is what the statistic is currently. Yes. But I always wonder how many more people didn't report it or
had it early.
Had it early or was a missed one.
Yes.
I mean, so it's 1 in 4 and I had so many people, Nicole said, who came out and were like, I had the same experience or we had a similar experience. And I was able to heal by talking to those moms and feeling that I wasn't alone. And there wasn't I couldn't express like why I was so sad. And I had another mom tell me like, it's not necessarily the life that like is lost that is so painful. It's like that loss of a future and like those future hopes and like all of that is crushed in an instant and how hard that is.
Yeah.
And so like when somebody was able to put words to those feelings that I was having, I felt so validated and so heard, and it was so important to have somebody I could talk to about it and who understood like where I was at.
Yeah. And just knowing that it was very common helped me, honestly, because it felt like there wasn't something wrong with me then. Because that was my first pregnancy, immediately I started thinking, what if I can't have kids? What am I going to do if I keep losing babies?
Like, what if I'm not strong enough to grow a baby?
Right.
That was like the thing I told myself so often.
What if this is going to keep happening? It's so much unknown, and just to know and hear from other women like, oh, I had lost a baby before my first son was born, or I lost a baby between 2 and 3. To know that they went on to have pregnancies was super comforting for me, but that fear was still so there. I was so terrified of not being able to actually carry a baby, you know? And so I think that it's just really important to talk about it. And I think we are getting better as a society.
Yeah,
honestly.
it's definitely becoming more talked about, more prevalent. I think people are better at acknowledging it. There's more, I mean, even when I think about like Pinterest, right? When I had my first miscarriage, Pinterest was like really new. You still had to like get an invite to use it. And I remember like searching on Pinterest and there was like nothing out there. But now you go out and there's like people who have like write entire posts about like
blogs
their experiences and like what a bereavement kit might look like. Or now there's bereavement doulas that people are talking about. And that has changed quite a bit. I think we still have a long way to go.
For sure.
Especially in the healthcare field, because I'm not sure that for me personally, it wasn't handled super well, but I was also in the ER.
Oh yeah,
and they're not great at handling OB stuff. Yeah. But you know, like I didn't know what to do. It was the first time I'd ever been pregnant, and for obviously my first miscarriage as well. And I didn't know how to handle it. I didn't know.
So how did they come in and tell you? Like, how did they come?
I would remember being in the ultrasound, and they were doing it. I could tell by the text, like body language and just like her facial expressions and like just the vibe in the room was not positive. Right. And so like I think I knew then. And then just the ER doc came in and was like, you know, the ultrasound shows that there's no heartbeat, sort of a thing.
Do you feel like he was like warm? Like,
I think it was very clinical.
Okay.
Right? Like I don't think he said the word baby. I think he said we didn't detect a heartbeat.
Wouldn't it be nice if they had a bereavement like
specialist or something, or mental health specialist who would like familiar
that could come
with
in
that?
And be like, you know, I'm so sorry, or you know, and just talk to you about it in non-clinical terms,
right?
And
because like for me, like that was still my child.
Offer you support,
and so like to just talk about it in such an abstract way was very. Like weird. And I was like, I don't know how I'm supposed to feel right now.
Right.
And then I think they were like, we'll give you guys some time, and walked out. And I remember just like just sobbing. Yeah. Like I couldn't.
And how many weeks were you?
I was 10 weeks.
10 weeks.
So we had one appointment, one ultrasound. Like that's all we had. And
but 10 weeks. I mean, that's
we're
far.
almost through the first trimester. We had told everybody at Thanksgiving. So I had to call my family members and tell them like that. I think that was the worst. That was the worst. Because I had to relive it over and over through every phone call. Or I can remember like maybe I should have been about 6 months pregnant and we were out with a friend and he was like, you can't be drinking that. You're pregnant. And I was like, I had to like relive it again. And like he didn't know any better. Like I mean it was totally like he was totally trying to like look out for me and like be a good friend. But again I had to like do it all. And actually his girlfriend then was like, hey, I've had a miscarriage too. Like people constantly like the more you talk about it, you know, the more people you share your story with come out and you're like, you know, I've been there, I get it. And, you know, I'm sorry he stuck his foot in his mouth. And I was like, you know, I know he didn't mean to.
I know.
But, like, that was, like, the worst. Like, that first year having to constantly, like, retell it. Or, like, people who hadn't yet heard or had seen it somewhere but not somewhere else.
Because you probably posted on social media at that point.
Because, like, I think my sister had posted. And she'd asked, like, is that okay? And I was like, oh, yeah, whatever. And so, like, we hadn't made, like, a big official announcement, but, like, there were plenty of people on Facebook that knew. Yeah.
Well, and speaking of reliving it, so when I had my miscarriage, I was fairly early. I was almost 6 weeks, so very early, but I did find out at, like, 4 weeks.
Right,
you know,
so it felt like you'd known.
We were doing ovulation tests, and we were trying to have a baby. And I went to the bathroom, and I was bleeding heavily and clotting. And I knew, I had felt kind of off the last couple days, but I was pretending I wasn't because I couldn't even handle it. I was like, I can't lose this baby,
That doesn't happen.
That doesn't happen to me, right? That's what we all think. And so I was bleeding, and I was actually at my friend's house, and she just held me and called my husband, and he came to get me. And it was just awful. And I cried the entire way to the clinic to get my blood tested, because they want to test you for your HCG, right? And I just was sobbing in the parking lot. And I was like, I'm sorry, but I just can't stop because I know that I've lost this baby. I had lost so much blood. And I went in to get my blood tested, and I just went to the regular
the regular lab.
Yeah. And they tested my blood. They didn't ask me any questions. They didn't ask me why I was bawling my eyes out, nothing. And when I left, I looked at the lab tech and I was like, is that it? And she's like, what do you mean? I was like, can I talk to someone about this? I am pretty sure I just lost my baby and I don't know what's going on and I'm freaking out and I'm a new mom and I just need to talk to someone.
Yeah. And I don't think they know how to handle it. And not that that's their fault, obviously, but I don't think there's enough training and there's enough resources, even within the healthcare community, to be able to handle that.
Yeah.
And I mean, I think I got sent home with a purple envelope.
Oh yeah,
that said here's your resources. But I was so distraught. I don't think I looked at that thing for
to someone.
4 or 5 weeks.
Yeah, and the fact that I had to ask, can I see someone, a doctor or someone? And they put me in a room and a nurse came in and she was very kind and she's like, I know that, this baby was part of your family and stuff. And she just let me cry. But I was like, what's going to happen to my body?
Yeah.
And that's something that no one talks about. And she's like, well, you're going to bleed for a long time. And that was really horrific for me because every time I went to the bathroom, it was like a reminder that I lost that baby. And it was horrible.
And it's not a quick thing.
It's not. It was a week maybe. I don't even remember. Maybe a week and a half of bleeding and cramping.
And I know for some women it goes on longer and you can opt for procedures.
I think it depends on how far along you were. Because you have to
how your body reacts.
Yeah, your body's getting rid of all that blood that it had been making,
all the extra tissue that's built up in your uterus, all of that, and you have to go through all of it. And so I would even argue there is a postpartum period after loss, whether that, especially if you're far along, but even if you're 6 weeks, right? Your body still is coming down from hormonal changes. There's still so much happening on so many levels.
I do wish that there was more I know that we can't go to a special lab to get tested, but just more training for lab techs to know, okay, this mom is coming in and she's probably losing her baby. So here's the steps we're going to take and we're going to talk to her about it. Because people, if I wouldn't have asked, I would have just walked right out.
Right.
And went to my car and been like, I don't know what to do next. Right. I have no idea.
Well, and not knowing what's going to happen to your own body is so scary.
It's so scary. And just,
and then you go to Dr. Google and they tell you all the terrible things. And it's just more reassuring to hear that from an actual medical professional face to face. Hey, this is what you may or may not expect. And call us if X, Y, or Z happens so that you know what to look for. Because if it is your first pregnancy, your first miscarriage, you have no idea what that's going to look like. Yeah. And so to at least have some sort of
And people don't really understand that it's such a physical thing. Because they're just like, oh, you lost your baby, I'm sorry. But you're also bleeding and a lot of things are happening just after you have a baby. People don't really know that sometimes. So there's just a lot going on. And if you are going through a miscarriage or have had a miscarriage, we see you.
We've been there.
We have been there. And we have both had pregnancies after, which have been affected because of a loss. I mean, my pregnancy with my first, so my son, Sam, every single time I peed, which as a pregnant woman is a lot.
All the time.
I was looking for blood every time.
All the way up until when she was born and in my arms. Yeah. The entire time I worried about it.
100% I worried. Every little twinge. I remember my dog was very big at the time and he had stepped, right here. And I was like, oh my God, I'm going to lose my baby. Yep. Because every single thing was so scary to me after that loss. I mean, peeing was scary. Any Braxton
any type of cramp or anything, cramps, terrifying.
Well, and round ligament pain.
Oh, yeah.
I mean, as a first time mom, you don't know what that is. And you're just like, why am I having having these pains, something's wrong, you know, and it could be something wrong.
All of a sudden you don't feel your baby kick for what you feel like is a long time.
Yes.
And you're like laying on your left side and you're drinking juice and you're doing all the things to trying to get your baby to move.
Coke
and anything you can do, right? And I can remember like being in appointments, and I remember one time our midwife couldn't find the heartbeat, and I like my heart just dropped. I think we were like 13 weeks along at that point.
And you're brought back to that immediately in the ER right away.
Immediately. That's where you go.
Yep.
And so I was very, very lucky to have the midwife I had. She immediately got on the phone and was like, we're going to get you an ultrasound. She goes, I'm pretty sure everything's fine, but I want you to feel comfortable. Right. I want you to be reassured.
Because that mental game is strong.
It is.
When you're...
It's a challenge.
And you can, like, hype yourself up so fast, you know? It's like, you don't
so
need
easily.
that.
You're like, oh, man, everything's going wrong. They can't find a heartbeat, blah, 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 blah. And, like, I think they had one midwife try, then they had another midwife try, then they brought in a second Doppler. And the entire time I'm just laying there like, oh, my gosh, when are they going to say it? They're going to say it. Like, you're just, like, holding it in your chest the entire time. And, you know, they sent me to get my ultrasound, and, like, everything was fine. But the entire time, like, I think I cried on the way to the ultrasound because I was so worried that was going to be what was going to happen. It was terrible.
I know. It's so scary, and I wanted extra ultrasounds because I wanted to just see that baby was moving, and I was like looking forward to that next ultrasound. I'm like, okay, I've got 3 weeks, I can do it, you know. And it's just such a process and so many things, and I had so many questions along the way, and I personally should have changed doctors, and I'll talk about my story in a little bit. But I mean, half the time I would be asking her questions and her foot would be halfway out the door. And I'm one, a new mom, two, a mom after a loss, and I'm terrified. And I have so many questions.
So many things I need to know.
And you don't have the time for me. And that was really, really hard. And so there's just a lot that when you're going into this pregnancy after a loss can be...
Yeah, there's definitely a mental game that's happening, and I think you just think about those things more. Like, I know for me personally, when I got pregnant with my oldest, Elena, I had found a group on Baby Center, and then there was a group of probably about 30 of us that ended up moving over to Facebook, like, as our pregnancies went farther. And I'm still friends with these women to this day. Like, I know who their kids are. Like, all of our babies were born, like, within a month or two of each other. And, like, we still lean on each other. Like,
finding that community
absolutely
is so important.
And I didn't have mom friends at the time because I was the first.
I was pretty much the first, too.
And it was so isolating to not have anybody who understood, like, that anxiety and that fear of, like, you know, every time you went to an appointment, like, are they going to find the heartbeat? And so being able to have that community was so important to me, and, like, I think really helped, again, make me feel not so alone in it.
For sure.
So we kind of talked about how pregnancy was, but as far as, like, Elena's birth, I'd really like to kind of run you guys through that. I mentioned earlier that, like, Pinterest was fairly new, because I got pregnant with Elena about a year after my miscarriage, and then it was terrible because her due date was actually the day I lost our baby. And so, like, again, it was a mental game the whole time.
That date, you remember.
Oh, you remember everything, right? And so she was due that day, and I was like, she can't come on that day. Like, she cannot. And so I thought about it all the time, but I had done a lot of research ahead of time, and I had read so much, and I had, like, read so many blog posts on Pinterest about the time, about, like, your birthing plans and, like, things you should know. And so I felt, like, really confident going into it, because I was like, okay, like, I know about kangaroo care, and I know, like, that's what they called it then.
I did the same thing on Pinterest, though. I read every single... There wasn't a lot at the time.
No, because it was still pretty new. Like,
so I read every like blog and birth story there was, and I would just keep rereading them. And it wasn't until after I had
how to pack my hospital bag.
Yeah, right. That's like all that there was on Pinterest at the time. But I found Birth Without Fear after. Yeah. And I wish I would have known about it before. Absolutely. There was birth stories galore on there. But sorry.
No, you're totally fine. This is how it's going to be.
We talk a lot.
And so I had, like, my birth plan, right, like, in place. And, like, as most of you know, when you have a birth plan, nothing actually goes according to that plan, because that's just not how birth works. But, like, I felt really confident going into it. And I still, like, looking back now, like, there's so much I didn't know, even though I thought I knew so many things.
I knew
so many things. And so I had to be induced because my blood pressure was getting a little high. We were at, like, 39, right around 39 weeks. And so we went in and we were like, yep, we're going to do this. We're going to have this baby. Because my midwives were like, yeah, if your blood pressure goes too high, we have to pass you off to the OBs. And I was like, no way. Like, and not that there's anything wrong with OBs. Yes. I had an OB from, like, my second pregnancy and my third pregnancy. But I had spent 40 weeks with these women. Right. Like, there was no way I could switch.
Yeah. So were you 40 weeks or?
I was 39
okay.
when we induced the first time. And then it was a failed induction, and they sent me home.
Isn't that the worst walk?
Yeah, you like walk out with your baby bag and like
I did the same thing with Sam, and it's like the walk of shame. Really,
like just
still
kidding, still pregnant, and like we, Facebook is really big at this point, and like and we have a lot of family spread out, and so we had posted like, oh yeah, it's baby time, like everybody's on baby watch, and then we were like, womp womp, just kidding, like no baby, here we go. So we went home, we slept, and then like that following Monday I went back in, and she was like, all right, I really think we need to try again for induction, your blood pressure is spiking again. And I definitely have like a little white coat syndrome, like I know that, but I was still carrying anxiety from that first pregnancy and that miscarriage. And I was like, okay, like whatever we got to do to get her here safely, like whatever that looks like. Yeah. So we did a second induction. That was successful. We had started like the night before. And then I think like by the next morning, so pretty early, we started Pitocin and we started doing some walking. And then because we had done the Pitocin, we had... I say we, but I had terrible back of the veins. Like horrible. Those cramps were awful. Yes. And so then I was like, all right, let's do an epidural. Because I had at this point been in the hospital since 5 p.m. the night before. I was tired. And I was like, okay, I gotta get some sleep. And so we did the epidural. I'm resting and I'm like listening to like thunderstorms. Because like that's relaxing for me. Noise. Right. Listening to my thunderstorms and like it's funny. I laugh about it now, but like a big boom of thunder went off in my headphones and like half a second later my water broke. And it was like, I mean, because I know it's like this thing, right? That like thunderstorms like or big storms always like cause women to go into labor.
That's crazy.
Yeah. And so like I don't know like what it was. Like maybe it's just like weird timing. But and then my water broke and I was like, I think my water just broke. And she was like,
felt like the pop.
Oh yeah. And like I never had that. Like the gush of water. Like I wasn't standing. I was laying in bed, but still like
everywhere.
Immediate.
And it like goes up your back.
Well, and she was like, are you sure? And then you can hear it dripping. And I'm like, yep, sure. Yep, pretty sure.
I didn't pee that much.
Right. Like it's everywhere. And so like that is when things like really kicked in. Yeah. And so like things are going fairly well. Like, my blood pressure is like mostly stable. So like we're not experiencing preeclampsia at this point or anything. Yeah. And so I think it's like we've been in probably 24 hours. So it's like 6 p.m. that night. And we're finally getting to the point where we're pushing. I'm dilated enough. I'm pushing. And things are going fairly well. I'm trying to remember with Elena. I think I was on my side. So I wasn't laying on my back because I knew I didn't really want to lay on my back, but I couldn't really get into many positions because of the epidural. Yep. And my epidural wasn't very strong, which I'm actually very thankful for because I could feel a lot and I could still move some.
Which is super helpful during pushing.
Yeah, absolutely. Yeah. And just like being able to like feel what is happening without like intense sharpness was great. Yeah. So I was able to feel kind of that. And all of a sudden, like we've got monitors. I think they had put a little monitor on her head, the electrodes, thank you. And they're like, the nurse looks at me and she's like, the heartbeat is dropping. You need to push now. And so I'm not having a contraction. So I'm pushing without a contraction and I'm panicking in this moment. Yeah. They stick an oxygen mask on my face and she is like in my face. Yeah. Like, you need to push now. You can do this, right? She's right in my stuff. And so I finally push her out and so, like, they give me an she's on my chest for a moment, but then I start to hemorrhage. And so hemorrhaging is when you bleed a ton. I don't think it's just after birth, but in this case, it was a postpartum hemorrhage, so after birth.
So your placenta has already come out at this point?
Yes, it has already come out. Okay. And the midwife goes, okay, you're bleeding kind of a lot. And like within seconds of her saying that, my room goes from her and her assistant to like 20 people. Yeah. So my baby is taken off my chest over to the warmer. My husband follows, and he's like half trying to look with me and like half trying to be at the baby. And I'm yelling at him like, just check on the baby. Because in that moment, I just didn't care about myself.
Well, and the dads don't know what to do at that time. Like I see
he's like, that's my wife laying over there.
That is my person, but this is my person now too. And where do I go? It's so conflicting when there's only one person. And he was the only one there.
No, so my mom and my sister and my mother-in-law are all there too. And so like, they're like, my mom and him are over with Elena, and then my sister and my mother-in-law are by me, and they are starting to push on my stomach. And here's I will never forget this. I have it so clearly in my head. I'm laying there and I'm looking up, and there's a reflective tile that I think was a light.
It's a light.
Yeah, it was a light, and I can see like what's happening below the waist, and they're pushing it, and like this gush of blood, like so much blood, and I remember in that moment being like, oh, that was a lot. Like, that's not normal.
Right.
And my sister, I look at her like maybe a second after that, her face is like white, and like, I was like, you need to go away.
Yeah.
Because I couldn't focus on her face and not rise into utter panic about like what that was. Yeah. And so, like I said, tons of people in my room. My midwife is gone, and there's some OB. I don't know what he's doing, right? But like taking care of things. And he goes, we might have to take you into surgery if we can't get this under control. And so like at that point, I'm kind of starting to panic a little bit more, but I'm still,
you've already had this baby.
Right.
Like,
but I'm like, where is my baby?
Yeah.
And so like, all I want is like to know that my baby is okay, because I only had her on my chest for like 10 minutes maybe. And then like done.
Yeah.
So finally we hit all of it under control, and they get everything taken care of, and I'm able to have my baby back. But I don't think like in the moment I realized like how intense and scary that was, because it was like maybe 2 or 3 weeks after that I just broke down.
Yeah.
And was like, wow, because like in the moment you're so focused on that baby.
Yeah.
And like self-preservation out the window.
Yeah.
Out the window.
And
like,
for the couple weeks after, you're like trying to learn breastfeeding.
Yep.
Which is
trying to do all the things.
And trying to heal. And you don't have time to like worry about your mental part about that.
Nope.
It comes back. It does come back.
And it came back with a vengeance. Yeah. Like I remember just breaking down and telling my husband, like, I could have died. And I probably should have had a blood transfusion.
Yeah.
And I didn't. And I didn't push for one because, like, I didn't know. Yeah. But because I didn't have a blood transfusion and I lost so much blood, my recovery was awful. Yes. Like, I literally felt like I had been run over. And it was a night and day difference with my other pregnancies. And again, first time mom, didn't know that, like, there was a difference. Say,
like, hey, can you tell me the options?
Right. Like, how can we move forward? Yeah. And it was over a holiday. So my daughter was born on a Tuesday. And then that Thursday was Thanksgiving.
Yeah.
And so she was not born on her original due date, but still close enough to Thanksgiving that we just didn't have quite as many staff like in the building.
Right.
So, I think our midwife stopped by, and we never saw a lactation consultant other than like just our nurses. Yeah. And so like we had kind of a lot of things happen in those first couple moments after birth, or those couple days after birth, that I think if I had known better, if I had more resources, that like would have changed our entire course of things and how we went forward.
Mm-hmm. So do you think that having your hemorrhage and everything, like how that changed how you went into postpartum or like after birth with your other two? Like, were you ready for that to happen again? Like, you were kind of like, if I hemorrhage, this is what I want a blood transfusion. I want all this different things kind of thing. Yeah.
Well, because I didn't even know that like I should have gotten one until like after like my 6-week postpartum visit and like then my 2-week visit like with my baby. And we had talked about like how birth went and stuff. And I was like, she was like running through what my record said. And she was like, you lost, I can't remember what the number is anymore, but she lost this much blood. And she was like, you didn't get a blood transfusion? Like, even my midwife was like surprised that I hadn't gotten one. And I was like, no, I didn't. She goes, you probably should have. You would have felt so much better.
And you're like, well, shit.
I wish somebody would have told me.
Why didn't someone tell me that?
I didn't know. But because of that, like, I was so exhausted. Like, and even more so than you are when you normally have a baby. But like, my milk never really came in. I didn't have that resource. So the second time around.
That is huge too. Yeah. Like, being able to make milk. It doesn't just come in just because. You got to be able to rest. You have to be
my body was more focused on making blood,
which is really hard to do.
That's what it was doing,
right? So it's making blood, and it's like, put the milk on hold for a second.
Pause.
But you got to be able to drink lots of water, and you don't want to drink water when you feel like you're going to throw up all the time,
right? Or when you're just like weak. Like all I wanted to do was sleep. I was so exhausted, and it was just. It changed the course so much, because then we struggled with breastfeeding for like a week and a half. And I finally was like, for my mental health, like I need to just formula feed, because I didn't know what my resources were. I didn't know how to do things. And then I got to the point where I was about to go back to work. And I remember being like, man, I should have reached out to people ahead of time, but again, I didn't know who those people were. I didn't know those resources were. And I was so deep into motherhood in those first couple of weeks, there was no way I was going to be able to find it at that time. Yeah. So then with my second pregnancy, I knew who the Leche League leader was. I knew when their meetings went. I went to the meetings while still pregnant so that like I knew familiar faces, because I was like, nah, not this time. Like I'm going to know what to do. And I remember so my second time I didn't have midwives. I had an OB, and so like her and I.
Were you high risk then?
No, my insurance had changed. Okay. And so, I mean, I'll cover that the next time. But I remember having an extensive conversation with her about, hey, I'm really scared about hemorrhaging. And then when I got to the hospital, I told my nurse, hey, I'm really scared about hemorrhaging. This is what happened last time. Yep. And she was like, okay. And she brings in this big red box, and she's like, that's our hemorrhaging kit. And she's like, it's kind of like Murphy's Law. Like, if you're prepared for it, it won't happen. And if you don't prepare for it, it'll happen. So we're just going to keep it there.
Like, this is what you need
and she,
to
like,
feel
showed, she showed it to me and was, like, right there on that counter. So I knew, like, okay, if anything happens, like, A, the team around me is aware. Yep. B, the kit is right there. Like, I can see it. Like, my husband could grab it if needed. Like, I'm not that we would know what to do with it. But I knew where it was.
He could hold it.
Right. I knew where it was. And so it was just, like, that, like, good juju I needed to feel more comfortable. And, like, they had heard me, and that was so important.
Yeah, that can make or break a birth, for sure. I mean, 100%. So my story with Sam is a little bit different. I could not wait to be pregnant. All I wanted to do was have a baby and be pregnant and glow and love my baby bump. And I got hit with hyperemesis. So hyperemesis gravidarum is an awful thing. I'm not going to lie. You saw it with my second because we weren't friends yet with the first. But basically, I was throwing up so much, and I am not
everything.
I am not just talking about morning sickness. This is like intense,
all day,
constantly throwing up. I could not keep food or water down, to the point where I got so dehydrated. At 8 weeks, my husband brought me to the ER to get fluids, and that's when they were like, so you have this thing called hyperemesis, and here are some meds that we can give you. And I was really scared to take the meds because I didn't know if they were really safe to take. And I did do research before I took them, and there's not a lot of research or like long-term research on it either. It's kind of like, it should be okay.
So, no studies have shown otherwise.
Right. But at the point where I was, I could have easily lost that baby because of malnutrition, and I could have lost my life, you know? So I decided to take a drug called Zolfran, which saved my life. Seriously. I mean, it made a world of difference. I was still throwing up at least 5 to 6 times a day, but that cut it in half.
Right, so at least something was staying down.
And it just helped me feel normal again. I remember my husband walking me around the block. He would like try to get me out of the house because I was just like, I was trying to sleep as much as I could because I wasn't hurting when I was sleeping. It was awful. But he walked me around the block, and he's like, I feel like people are going to think you're a cancer patient because I was like so brittle and so helpless. And I was like, I don't know how to function right now.
Right.
I mean, I was working as I had just started my photography business full time. And so he would like drive me to sessions. I would work for like 25 minutes. And then I'd get back in the car and throw up and be like back to bed. It was nuts. I remember I couldn't even edit. I couldn't even sit at my computer and edit because I was just throwing up so much. It was just so horrible. I have teeth damage.
From the acid.
From the acid, from throwing up so much. It's insane. And so around, I think, like 22 weeks with Sam is when I started to feel better.
When you say better, though, is that like it went away?
No, it stays. It was the entire time for me. But I could function. I could get out of bed. I could shower. Okay, showering is a big thing when you have hyperemesis because, at least for me, in my personal story, I didn't have the energy to stand up in the shower and wash my hair. I didn't. So I would lay in the bottom of the tub, like, it was so sad. And I would just, like, watch the water go down the drain. And that was, like, what I would do. I would just lay in there and let the water wash over me, and then I would get out. And most of the time I wouldn't wash my hair because I did not literally, it took energy to get in the tub. I wasn't going to wash my hair. So I could actually wash my hair again. I could shower. I could eat some food. I knew I would throw it up, but at least it was somewhat enjoyable.
Right.
So my pregnancy with Sam was disappointing to me because
do you feel like you were like robbed of something that like pregnancy joy and like
to love it
the picture perfect image that is so often like presented.
I also felt like I couldn't complain because I had a loss before, and
so you should be grateful.
Was so loved that I should be grateful. So I also felt like I couldn't be like, you know what, this really sucks. And
even though it did,
suck. It's really horrible. And I threw up the entire pregnancy, all the way up to giving birth. I threw up during birth. But then the second I had him, the hyperemesis was gone. So it's a weird thing. But basically my pregnancy with him, like I said earlier, when my doctor, I was like asking her questions and she would be like halfway out the door. And I'm like, but I've
been vomiting for
I don't know what's going on. And I was having Braxton Hicks really early on with his pregnancy. So like starting like 22 weeks, I think, when I started to feel better. Then I started having Braxton Hicks, which if you don't know what Braxton Hicks are, they're basically like this pretend labor
practice contractions.
And they're not painful, but your belly gets really tight and you feel like you can't breathe. And you're like, what?
They're definitely uncomfortable.
Yeah, I mean, you know that they're happening, but they're not painful. And so I started to panic because I'm like, how am I going to know if I'm in labor if I'm having these? And everyone was like, you'll know. And I hated that answer until I gave birth. And then people would ask me and I'd be like, you'll know. Because it is true. Like, you know real labor.
Yeah.
But I struggled with being able to connect with my provider, and I didn't understand that I could change providers. I didn't need to stay with someone just because I had been seeing her. I wish I had known that. And I wish I had advocated for myself more. Yeah. I would have felt a lot more at peace and taken care of, I think. But we were like 39 and 5. And I woke up at like 5 in the morning and I had a contraction. And I was like,
oh, snap. Here we go.
I was so excited. I got up and ate a bowl of cereal, and then I threw up. and then I took a shower because I was like, I'm going to shower. I'm going to like be awesome in this birth. And then they stopped. Wah, wah.
Right.
And at this point, it's like 7 a.m. My husband's still sleeping. So I was like, well, I'm going to go back to bed.
Yeah.
And I'm going to sleep. So I slept for a little bit. And then we got up and I was like, I hate being pregnant and I want to be done. So let's get this baby out. And so we went, it was snowing because this is the middle of February. It had started like a snowstorm at this point, this day. And so we went to Anytime Fitness and I walked on the treadmill. I'm like massively pregnant wearing my husband's shirt because nothing else fit me at this point. And I'm like walking this treadmill because I'm like, get this baby out. And so my contractions started to come back again. And I was so naive, silly Nicole, that I was like, you know, the 5-5-1 rule. Yeah. I was like, let's go to the hospital. We got it. It's 5-5-1. You know, I was so pumped. I should have known better because I was still laughing. We took a picture at a stop sign. We're like, going to the hospital. Dummy. So we walk, and as you gave birth at St. Mary's the first time, right? So the St. Mary's Hospital here in Madison is like the longest walk in eternity to get to maternity care, right?
Well, and you have to park in the parking garage, and then you have to walk across the skywalk,
and then you gotta like go,
and then it's like a whole trek from there
walk.
too.
It's ridiculous. And I didn't have much trouble getting there, which should have also been a sign. To just go back home. So I get checked into triage and they check me and I'm 1.5. Oh. And I was 1.5 at my last
so discouraging. So
I hadn't even changed. And they were like, yeah, go home.
Bye.
You crazy. So we went home. And at this point, the snowstorm was real intense, and we usually only have like a 15-minute drive home. And this turned into over an hour because we were stuck in traffic because there was an accident. Mm-hmm. And then we decided to stop at the local grocery store because I was like, I'm going to make food. There's this funny story of when my mom was in labor with me that she like made a pie and she forgot to take the plastic wrapping off it. She like
melted your pie.
Yeah, she like fed it to some family and they had plastic wrapping in it. But it was like I just felt like I wanted to make food because she made food in labor with me.
And you were like, I can do that.
And so we're at the grocery store, and I'm starting to have contractions now that take a little bit of time to like concentrate, but I don't want anyone to know I'm in labor because like I don't want people to panic that I'm going to have
that's weird.
a baby in a grocery store. So I'm like, looking at this cake. Look at that cake. It's really good. I'm just going to stand here and look at it for a little bit longer. So we finally get home, and I decided I'm going to make, like, one of those veggie pizzas with, like, the
crust croissants and the ranch and stuff.
All the stuff on it. And it took me, like, 2 hours to make this thing because I was having contractions. And then I decided I'm going to, like, use the ball. I'm gonna, just like hang out.
I feel like every first time mom has a ball, I bought that ball from Target so I could bounce on it to help with labor.
Yeah.
I didn't use it.
I like leaned on it maybe, but then so like 5 hours after we got sent home, I was like, okay, these are getting stronger, and I don't know what this is supposed to feel like. I don't know what's gonna get worse. I'm a first time mom, and I'm super not very educated on it all, even though I thought I was. And so we decided to go back to the hospital. They checked me in, and I'm 3.5. And technically, they don't like to keep people at this time if they're less than a 4. And I was like, I'm not going home again.
No.
I will walk around the hospital, but like I'm not going back out in that snowstorm, massively pregnant in labor. No.
Well, and could you imagine if you had like ended up in a ditch or something? Right. Had gotten back home, like, and I know it happens that people have their first baby at home, but I was that's
not
terrifying
prepared for that. I had a home birth with my second. I was 100% prepared, but like first time, no. So they allowed me to be checked in.
So nice.
Thankful. And I was like, I'm going to walk. I'm going to do all these things, right? And so I had started walking, and I hated it. I was like, this is awful. Get me back into bed. So I got back into bed, and then I was like, you know what? I love water. I'm like a water person. I'm a Cancer horoscope, and it's supposed to be like water is our thing, and it really is for me. And so I was like, and it's funny because Charlie my second was born in water. Mm-hmm. She's also my birthday buddy. So that's funny when you think about it that way.
Cancer.
Yeah. So they filled up the tub. I sat in it one contraction out because
you didn't enjoy it, or like was the water cold?
It wasn't like a big tub where you could like lean against it and let your belly hang. You literally had to sit in it just like a normal tub at home, but it went higher, and I didn't want to just sit there like through all those contractions. So I get out, and I was like, I want an epidural, and my plan had been. I had actually told my doctor at my like 38-week appointment that I was like, I'm not like against an epidural, but I want to try to do it naturally. Yep. And then if I need it, I know that it's there. And she laughed at me. She actually laughed in my face. She was like, yeah, you're going to get it. And I remember I felt like ashamed then when I was getting it, because I was like, she laughed at me. Yeah. So stupid. I should have changed then. But again, didn't know I could. And so I wanted an epidural, but I could not get one until I was a 4. Still 3.5 after. So I didn't get the epidural until like 20 hours into labor because I was finally a 4. I don't think they have those rules now, but that definitely was a rule then. So, epidural. With Sam's birth, the epidural is probably the biggest thing that happened in it because I had a botched epidural. So, basically, again, never hadn't gone through this. My husband doesn't know what to expect. And we had a night nurse who wasn't totally warm and fuzzy. And so, we started to get the epidural. And when you get an epidural, you like sit up and
right on the edge of the bed, you got a hunch,
and you're having contractions, and he's poking me in the spine, and then he's saying, are you feeling it on the left or the right? And I'm like, on the left. Okay. Takes it out, puts it in again. And he did that 12 times.
12?
Over an hour. Jeez. An hour has gone by of me sitting like this, and he's just taking it in and out. So I'm like having so many pokes in my spine, which is very painful. And
you're having contractions.
And no one's saying anything. I don't know this isn't normal.
Right.
My husband at one point looked over, and there's just like blood dripping down my back. And he doesn't know that this is not normal. And so it was awful. And after the last one, he's like, okay, we're set, So I'm done with epidural, I think. And I go to lay down and he had placed it really low, so I have no feeling in my legs at all. They were completely numb.
Yeah.
And with an epidural, you should be able to feel a little bit, maybe be able to like move your toes or something. None for me. So the nurses had to like move me
like
from side
physically
to side. Yeah, like
around.
a couple nurses would have to come in and they'd put me with the peanut ball because my cervix wasn't dilating. Another thing I found out with my second is I don't have regular contraction patterns. My labor can be like 6 minutes apart, or contractions to 1 minute apart, to 1 minute apart, to 5 minutes, to 3 minutes. It doesn't go in the like picture
a traditional like
3
pattern.
minutes or 2 minutes apart. And so with my first birth doing that, they were like, we got to get this regulated. We're going to put you on Pitocin. And I was like, okay.
Sure.
And then they were like, we're going to dilate your cervix more because I wasn't as far as they wanted. So they did the balloon catheter and like dilated my cervix. I'm pretty sure they did electrodes on his head too, like all the things. And
were you able to get up and walk around? No, because you had your epidural.
Yeah,
that's right.
Yeah. So I was like not even wanting to walk around that way. So I was like,
I'm done.
I just want to sit in this bed. Give me the epidural. And so 2 hours go by. I was able to rest a little bit because I had been up for like 20 some hours at this point with this labor. And all of a sudden I start to feel contractions again on my left side, not my right. And I was like panicking because I knew I was only like a 4. And I was like, I have so much longer to go and this is wearing off already.
Yeah.
And so the nurses do the little ice bag test to see. And they're like, yeah, you can feel it over here. That's weird. So they get this new anesthesiologist come in. He's wonderful. Where was he 2 hours ago? I don't know. But he's like, yeah, this is placed really low and I don't like it. So I was in the middle of a contraction when he's explaining this. And he's like, I can either take it out and try to replace it, but there's a chance I won't be able to get it back in and you won't have an epidural at all and you're a 4. Or I can just keep pushing stuff through it and maybe it'll help you, but it will wear off and your body will get used to it. And so I'm in the middle of contraction. I was like, give me the drugs. And then he was very kind and he waited. He's like, I always wait till after to ask.
Smart man.
Smart man. So I was like, yeah, let's replace it. I've already done this 12 times already. May as well,
At this point.
Yeah. So I was very scared that it wasn't going to be placed back because I was like, what do I do?
Right.
I didn't have coping mechanisms in place for that. And so he replaces it. He was a wonderful person. He had like this whole grid that he would put on my back. And Sean was like, this other guy had like a tackle box. Like, what is happening?
Was there like a daytime, nighttime?
Yes.
Okay.
Yes.
So there was a
difference.
shift change.
Yes.
Okay.
And he basically told me like, it's all placed. It's all wonderful now. Like, you're going to be fine. But I had like PTSD from that epidural. It was funny because I heard the nurses talking about it because like every time I would switch sides, I'm like, I think I feel it over here again, and they would do the ice test and they're like, no, honey, you're fine. And I'm like, no, it's coming back. It's going to wear off again. And I heard them say, I think she has like PTSD from the epidural. And I didn't think about it that way until that moment. And I was like, okay, Nicole, you need to calm down. You're taken care of. But like, I felt so panicked because I didn't know. And they were checking me like every hour and they're like,
cervix checks?
Yeah. They're like, you're like a 5. Oh, you're still a 5. You're still a 5. You're a 5.5. Like,
and like, I don't think that's something people realize. They can say, no, I don't want to be checked right now.
You can definitely say no.
And like, I think sometimes it's better to say no because it can be really mentally discouraging.
Very mentally discouraging because I felt like my body didn't know how to do it. And there was a point at 30 hours in that I looked at my doctor and I was like, okay, when do we do a C-section?
Oh.
Which, like, no one says that.
In retrospect, right? You're like,
and
what?
especially I would not have wanted one could I avoid it. But I was begging for it because I was so done with this labor. I was so exhausted. I was like, what is happening? I don't know why I'm not progressing. And I wish someone would have been like, this is normal for a first baby. Yeah. Like, it's going to take a while to progress.
Like, your body's trying to figure out what to do.
Right. Like, you're doing amazing. And I wish, and I did, my doctor did kind of look at me through, I was like, holding on the bars. Like, she was like, you're doing great. You're okay. And I was like, oh, okay. I just needed someone to tell me that I was doing okay.
I just needed some reassurance.
Yeah, to be validated and know that it was okay. And so finally, they checked me and I was a 10. Yay! Hey. And I started pushing and I pushed for 2.5 hours with Sam. He has massive shoulders and a big head. And he was 8'10".
Big old baby.
22 inches, I believe. Or maybe 21.5. But either way, big. And I just remember, like, the second I, like, pushed his head out, I was like, oh, like, this relief. Like, when the rest of the body slides out, it's, like, the weirdest relief you've ever felt in your life. Because there's so much pressure. Mm-hmm. Even with an epidural, you still feel the pressure. And I was just like, oh, gosh, you know?
I'm done.
Sweet relief. And he's on my chest, and you can't really see them. You're like,
you're doing that weird, like, neck tuck thing.
So many chins. But Sean was crying next to me, and he was, like, checking all of his fingers and toes and stuff. And they mentioned, so you have some tears. You have 4 tears. Oh, my God. And since it's a training hospital, they just decided to let the resident. They didn't ask me, but they let the resident stitch me up. Which would have been fine if the numbing medication would have worked, but they kept poking me with the numbing, and they're like, it's
you
not
had an epidural. Like, I would have thought that, like, I mean, and this actually,
I think
same thing happened to me.
Off though once you have the baby.
I think,
right?
I don't know, because
I'm pretty sure.
Similar thing happened to me where I had an epidural, but it, like I had said, it was pretty light. But I had a small tear, so I think I was getting 1 stitch, and he starts to stitch, and I was like, whoa!
It's a different kind of pain.
Yeah, and he was like, you can feel that, and then they just stab you with the lidocaine, and you can feel that too.
You can feel that lidocaine. Gosh, and that was the thing. They kept sticking me with the lidocaine, and finally I was like, just do this.
And it burns. Yeah. Like, lidocaine is not.
It was and it just wasn't working for me for whatever reason. My body was like,
somebody's metabolized it weird. Yeah.
So I was like, just do the stitches and get this done. Like, I want to be done and hold my baby. And he did the stitches, and my doctor looked at them and was like, I don't like those. I'm going to take them out.
Oh my God, no.
Redo them. I wish she would have stopped after the first one, but she let him do all of them.
How many did you have?
I had 4 different tears. So I don't know how many stitches I got.
But they were
intense. So she took them all out and redid them. Again, I don't have numbing medication. So this is like an hour and a half of me getting stitches.
Oh my gosh.
After the pokes in my back. Right? So it was just a shit show. My face was like white. And Sean was like, we need to get you food or something. Because I was like, and then they got me up to go to the bathroom after all this. And I've never passed out in my life before, but I sat down on the toilet and I was like to the nurse, my hearing is going and now my vision is going. And I just started falling. And so, like, a million nurses come in the room, pick me up and put me in bed.
They're quick.
And they were like, you now get to pee in a bedpan.
Here's your fall wrist bracelet.
Laying down, peeing in a bedpan. It's the weird, and everyone's watching you.
Yeah.
So pee. It was very hard to pee. So yeah, it was kind of a crazy thing. I didn't really have many issues. I mean, I had some issues postpartum with the epidural, because I had been poked so many times in the back, my headaches were insane.
Epidural headaches are real, and nobody tells you about them.
Well, and they tell you, you can go in and get another epidural for it. The last thing I want to do is have someone poke me in the spine. Epidurals. So I just did it. I just, managed it. Mm-hmm. And I remember I wanted to take a shower. It had been a couple days after birth, and Sean had to actually hold me up in the shower because I didn't have the strength because the headaches were so horrible. And I didn't really have much strength in my back. And I had numbing in my back. My lower back was completely numb. I couldn't feel anything. And we were like, maybe this is just permanent damage. I don't know what's going to happen because no one talked to us about it either. No one came in and was like, hey, I heard you got poked like 13 times in the spine. We should talk about that. And
what
the
that
things
might
that
look
are
like.
going to happen. No one talked to me about it. I had to do my own research. And, I remember they sent a survey and I wrote about it on there, but that's all I did. I should have talked to them more about it had I known I could.
Right.
But yeah, we weren't sure if I was going to have back damage or not. And it was 3 or 4 weeks before I started getting some feeling back in my back.
That's a long time.
Yeah. But I mean, Sam's 5.5 and I have permanent back damage that I have to see a chiropractor. I have to work extra hard on strengthening my back. And I'll always have back issues because of it.
Because of it, yeah.
Which is why I chose to have a home birth with my second, which we are going to talk about in the next episode because this is already getting really, really long. But yeah, I mean, I chose a home birth specifically because I didn't want to be tempted with an epidural because it's fucking tempting.
Yeah. in the throes of labor.
Give it to me. I don't even care how many times you poke me. Just give it to me. And I didn't want to be tempted with it. So that's the biggest reason I chose a home birth with my second. But back to Sam, I mean, our breastfeeding journey was pretty good from the get-go. I did have a lactation consultant come in, and she showed my husband how to help because my son wasn't like opening his mouth wide enough, and like he had to have like his lip pulled down.
Yeah, like that.
And she showed him how to do that because your hands are full.
So full.
With, like, your boobs are huge, and you've got this little tiny baby that you're trying to
that floppy head.
Yeah, so you've got like both hands in it, and so him helping and being shown how to help was really helpful. And we had a really great breastfeeding journey.
Did you take like breastfeeding classes like beforehand or like?
I mean, the hospital ones.
Yeah, that's what we took. It was like, I think it was maybe a 2-night course or something, or maybe a 1-night course.
Yeah,
I don't remember.
It was not really in depth on actual like breastfeeding stuff, but I was just really, really blessed with an easy journey. Honestly, I didn't have many latch issues or anything. I had really good supply. I loved making lactation bars and stuff like that. And I did struggle with thrush with him at 2 months and mastitis once because I was at a wedding and didn't pump enough. I was shooting the wedding, so yeah, that was my bad. But we nursed to 22 months until I got pregnant with Charlie, and then I was so sick because of hyperemesis that I could not give him my calories, and so I had to be done. But we had a pretty good journey with that, and I had baby blues hard with him, but other than that, I had a pretty good journey in postpartum with him. So
yeah, I would say like after we got over like the initial struggles of recovery, like due to the hemorrhaging and stuff, and like finding our groove, it was pretty easy. I think like my other ones after were harder almost. Well, and like I'll touch on those. Yeah, every time you add a kid, like
it's nuts. Going from 1 to 2 was the hardest. I mean, I don't have more than 2, so I can't go off of that. But going from 1 to 2 was so intense.
0 to 1 was easier than 1 to 2.
Yeah. Because 1 to 2, someone always needs you.
Right. Like, there's 2 of them.
There's 2 of them, and they never sleep at the same time.
Why would they do that?
I mean, they're just, and then you've got a toddler who's like just a terror.
A monster. Not all toddlers are monsters.
Yeah, but mine was. So, yeah, it was the whole thing. But we have a lot to talk about still. I mean, you have 2
I have 2 more kids.
I have another birth that I will talk about my home birth. So next episode, we will keep talking about our birth stories, and then after that we will dive into some other stuff, so
cover all the other things. Don't forget to subscribe, hit your little bell for your notifications so you know when we post an episode.
Download our podcast. And yes, we are recording all of these. We didn't mention that in the first one. We probably should have. We are recording these and putting them on YouTube, so if you want to watch your podcast or like see our faces, you
come sit at the table with us.
Yes, come sit at the table. You can go onto YouTube and follow us there, or you can listen to us anywhere that has podcasts like Spotify and the podcast app. So yeah.
So comment, give us suggestions. If you've got questions, you want to know more, you can always throw a comment in down below, shoot us an email, connect with us on socials, all those good things. But we will see you next time. Thanks, guys. Bye.